Hello, everyone. My name is Emily, and welcome to English Club. I am so happy you are here today. We make videos to help you learn English. Today, we have a very useful and practical topic. But first, let me say hello to my friend Paul. Hi, Paul.
Hi, Emily. Hello, everyone. I am Paul. It is so nice to be here today. How are you doing, Emily?
I am doing well. Thank you so much for asking, Paul. Actually, I am feeling much better today. I was a little bit sick last week, so I am happy to be healthy again. How about you? How are you feeling today?
Oh, I am sorry to hear you were not feeling well last week, Emily. I am glad you are better now. I am doing fine today, thank you. I am healthy and feeling good. What was wrong last week? Were you very sick?
Thank you, Paul. No, it was not too serious. I just had a cold. I had a runny nose, a sore throat, and I was sneezing a lot. You know, typical cold symptoms. But I rested for a few days and drank lots of tea, and now I feel much better.
That is good, Emily. Colds are very common, especially in the winter. I am glad you took care of yourself and rested. Rest is very important when you are sick. Did you go to the doctor, or did you just rest at home?
I just rested at home, Paul. It was just a common cold, so I did not need to see a doctor. I took some vitamin C, drank warm tea with honey and lemon, and slept a lot. After about 3 or 4 days, I started feeling better.
That is good, Emily. Colds are very common, especially in the winter. I am glad you took care of yourself and rested. Rest is very important when you are sick. Did you go to the doctor, or did you just rest at home?
I just rested at home, Paul. It was just a common cold, so I did not need to see a doctor. I took some vitamin C, drank warm tea with honey and lemon, and slept a lot. After about 3 or 4 days, I started feeling better.
That sounds like good self-care, Emily. Sometimes our body just needs rest and time to heal. So, did you have to take any time off work because of the cold?
Yes, I took 2 days off work, Paul. I stayed home on Wednesday and Thursday. I did not want to go to work and spread the cold to my colleagues. And also, I really needed the rest. I felt very tired and weak.
That was the right decision, Emily. When we are sick, we should stay home and rest. Going to work when you are sick is not good for you, and it is not good for other people either. You can make other people sick too.
Exactly, Paul. That is very important. We should be considerate of others when we are sick. Nobody wants to catch a cold from a colleague at work, so staying home is the responsible thing to do.
Absolutely, Emily. Well, I think this is a perfect introduction to our topic today. We are going to talk about how to talk about feeling sick in English. This is a very practical and important topic.
Yes, it is, Paul. Everyone gets sick sometimes, right? So we all need to know how to express how we feel, how to talk to doctors, and how to tell our boss or our friends that we are not feeling well.
That is right, Emily. Okay, so everyone, before we start today's topic, please like and subscribe to our channel for more English learning videos. We really appreciate your support. It helps us a lot.
Yes, please do subscribe. We make new videos every week to help you learn English. And if you like our videos, please click the like button. It really helps us continue making content for you.
Thank you so much, everyone. Okay, Emily, so today we are going to talk about feeling sick and all the useful vocabulary related to health and illness. This is important because when we travel to English-speaking countries, or when we work with English speakers, we need to be able to communicate about our health.
Absolutely, Paul. Health is one of those universal topics that everyone needs to talk about sometimes. Whether you are at the doctor, at work, or just talking with friends, you need to know how to express that you are not feeling well.
Yes, Emily. So let us start with the basics. How do you tell someone that you are sick? What are the most common ways to say you are not feeling well?
Good question, Paul. The most simple and common way is to say I am sick or I feel sick. This is very direct and clear. For example, if someone asks, "How are you?" you can say, "I am sick" or "I feel sick."
Yes, Emily. That is the most basic way. We can also say, "I am not feeling well" or "I do not feel well." This is a little more polite and less direct. For example, "I am not feeling very well today. I think I should go home and rest."
Perfect, Paul. Another common expression is I am under the weather. This is an idiom that means you are slightly sick or not feeling your best. For example, I am a bit under the weather today, so I might leave work early.
Great example, Emily. Under the weather is very common in everyday conversation. It is a gentle way to say you are not feeling well. We can also say, I am coming down with something. This means you are starting to get sick.
Yes, Paul. Coming down with something means you feel the first symptoms of an illness. For example, I think I am coming down with a cold. My throat feels a little sore and I'm very tired.
Excellent, Emily. Now let us talk about different types of sicknesses and illnesses. What are the most common illnesses that people get?
Well, Paul, the most common one is probably a cold. A cold is a viral infection that affects your nose and throat. The symptoms include a runny nose, sneezing, coughing, and sometimes a sore throat.
Yes, Emily. Almost everyone gets a cold at least once or twice a year. Another very common illness is the flu or influenza. The flu is more serious than a cold. It usually includes fever, body aches, headache, and extreme tiredness.
That is right, Paul. The flu can make you feel very sick. You usually need to stay in bed for several days. The symptoms are stronger than a cold. With the flu, you often have a high fever and your whole body hurts.
Exactly, Emily. Another common problem is a headache. Almost everyone experiences headaches sometimes. A headache is pain in your head. It can be mild or severe. For example, I have a terrible headache today. I need to take some medicine.
Yes, Paul. Headaches are very common. We also have stomachache or stomach pain. This is pain in your stomach area. For example, I have a stomachache. Maybe I ate something bad.
Good example, Emily. We can also have a toothache, which is pain in your tooth. For example, I have a terrible toothache. I need to see a dentist. Or we can have a backache, which is pain in your back.
Yes, Paul. We use the word ache for many types of pain. Headache, stomachache, toothache, backache, earache. The pattern is body part plus ache. This is very useful to remember.
Excellent point, Emily. Now, let us talk about symptoms. Symptoms are the signs that show you are sick. What are some common symptoms?
Well, Paul, one very common symptom is fever or temperature. When you have a fever, your body temperature is higher than normal. Normal body temperature is about 37 degrees Celsius or 98.6 degrees Fahrenheit. When you are sick, it can go up to 38, 39, or even 40 degrees.
Yes, Emily. Fever is a sign that your body is fighting an infection. Another common symptom is cough or coughing. When you cough, you push air out of your lungs suddenly and noisily. For example, I have been coughing all night. I could not sleep.
That sounds uncomfortable, Paul. Another symptom is a runny nose. When you have a runny nose, liquid comes out of your nose. You need to use tissues to wipe your nose. This is very common with colds.
Yes, Emily. We can also have a stuffy nose or blocked nose. This is when your nose is blocked and you cannot breathe through it easily. For example, my nose is so stuffy, I can only breathe through my mouth.
Good example, Paul. Another common symptom is sneezing. When you sneeze, air suddenly comes out of your nose and mouth. It makes a loud sound like achoo. Sneezing is very common with colds and allergies.
Yes, Emily. And we often say bless you when someone sneezes. This is a polite thing to say. Now, another symptom is sore throat. When you have a sore throat, your throat hurts, especially when you swallow. For example, I have a really sore throat. It hurts to eat or drink.
That is very uncomfortable, Paul. Another symptom is feeling tired or fatigue. When you are sick, you often feel very tired and weak. You do not have energy to do normal activities. For example, I am so tired, I just want to sleep all day.
Yes, Emily. Tiredness is very common when you are sick. Your body uses a lot of energy to fight the illness. Another symptom is nausea or feeling nauseous. This means you feel like you want to vomit or throw up. For example, I feel nauseous. I think I ate something bad.
Yes, Paul. Nausea is very unpleasant. And if the nausea is very strong, you might vomit or throw up. These words mean to bring food back up from your stomach through your mouth. For example, I vomited 3 times last night. I think I have food poisoning.
That sounds terrible, Emily. Food poisoning is when you get sick from eating bad food. Another symptom is diarrhea. This is when you have to go to the bathroom very often and your bowel movements are very liquid. This is not a pleasant topic, but it is important medical vocabulary.
You are right, Paul. These are important words to know, especially if you need to talk to a doctor. Another symptom is dizziness or feeling dizzy. This is when you feel like the room is spinning or you might fall down. For example, I feel very dizzy. I need to sit down.
Yes, Emily, dizziness can be dangerous, especially if you are standing or walking. You should sit down immediately if you feel dizzy. Now, let us talk about pain. How do we describe different types of pain?
Good question, Paul. We can use different adjectives to describe pain. We can say sharp pain, which is sudden and strong like a knife. For example, I have a sharp pain in my chest when I breathe.
Good example, Emily. We can also say dull pain, which is a constant, not very strong pain that does not go away. For example, I have a dull pain in my lower back. It has been there for days.
Yes, Paul. We can also say throbbing pain, which is pain that comes in waves or beats, like your heartbeat. For example, I have a throbbing headache. It feels like my head is pounding.
Excellent, Emily. We can also say burning pain, which feels hot like fire. For example, I have a burning pain in my stomach. Or we can say stabbing pain, which feels like someone is stabbing you with something sharp.
Yes, Paul. These adjectives help us describe exactly how we feel. This is very useful when talking to a doctor. The doctor needs to know what type of pain you have to make a correct diagnosis.
Absolutely, Emily. Now, let us talk about what we do when we are sick. What actions do we take? What treatments do we use?
Well, Paul, the first thing we usually do is rest. We need to rest and sleep when we are sick. Sleep helps our body heal and recover. For example, the doctor told me to rest for a few days and not to go to work.
Yes, Emily. Rest is very important. Another thing we do is take medicine or medication. Medicine can help reduce symptoms and make us feel better. For example, I took some medicine for my headache and now I feel better.
Yes, Paul. There are many types of medicine. We have painkillers or pain relievers for pain. We have antibiotics for bacterial infections. We have cough syrup for coughs. We have fever reducers for fever. Each type of medicine treats different symptoms.
That is right, Paul. We should always follow the instructions when taking medicine. We need to take the right dose at the right time. For example, take 2 tablets 3 times a day after meals. It is important to follow these instructions carefully.
Absolutely, Paul. Taking too much medicine can be dangerous, and not taking enough might not help. Now, another thing we can do is drink lots of fluids. When we are sick, we should drink water, tea, juice, or soup to stay hydrated.
Yes, Paul, staying hydrated is very important. Our body needs water to fight infection and to replace fluids we lose through fever or sweating. For example, make sure you drink at least 8 glasses of water a day while you are sick.
Good advice, Emily. Another helpful thing is to eat healthy food. Even if we do not feel hungry, we should try to eat light, nutritious food like soup, fruits, and vegetables. These foods give our body energy and nutrients to fight the illness.
Absolutely, Paul. Chicken soup is especially good when you have a cold. It is warm, easy to digest, and has nutrients. Many people call it comfort food. Now, sometimes we need to see a doctor. When should we go to the doctor?
Good question, Emily. We should see a doctor if our symptoms are very severe, if they last for a long time, or if we are worried. For example, if you have a very high fever that does not go down, you should see a doctor.
Yes, Paul. Also, if you have chest pain, difficulty breathing, severe pain, or if you are vomiting blood, these are emergencies and you should go to the hospital immediately. These symptoms can indicate something serious.
Absolutely, Paul. It is always better to be safe and see a doctor if you are worried. Now, let us talk about going to the doctor. What do we say at the doctor's office? How do we describe our symptoms?
Well, Paul, when you arrive at the doctor's office, you usually need to make an appointment first. You can call and say, I would like to make an appointment with the doctor. I am not feeling well.
Yes, Emily. The receptionist will ask you some questions like, what is the problem? Or what symptoms do you have? You should briefly explain your main symptoms. For example, I have a fever and a bad cough.
Good example, Paul. Then the receptionist will give you an appointment time. When you arrive at the doctor's office, you might need to fill out some forms with your personal information and medical history.
Yes, Paul. Medical history includes information about previous illnesses, allergies, and medications you were taking. This is important for the doctor to know. Then you wait in the waiting room until the doctor calls your name.
That is right, Emily. When you go into the examination room, the doctor will ask you questions about your symptoms. The doctor might ask, when did the symptoms start? Or how long have you been feeling sick?
Yes, Emily. The doctor will also ask, what are your symptoms, or can you describe how you feel? This is when you need to explain clearly. For example, I have had a fever for 3 days. My temperature is about 39 degrees. I also have a headache and body aches. Excellent example, Paul. The doctor might also ask, have you taken any medicine? Or do you have any allergies? You should answer honestly and completely. For example, I took some paracetamol yesterday for the fever, and I am allergic to penicillin.
Very good, Emily. Then the doctor will examine you. The doctor might check your temperature, listen to your lungs with a stethoscope, look at your throat, or feel your stomach. The doctor might say, open your mouth, or take a deep breath, or does this hurt?
Yes, Paul. You should follow the doctor's instructions during the examination. After the examination, the doctor will make a diagnosis. The diagnosis is the doctor's opinion about what illness you have. For example, the doctor might say, you have the flu, or you have a throat infection.
Exactly, Emily. Then the doctor will recommend treatment. The doctor might prescribe medicine, which means the doctor writes a prescription for you to get medicine from the pharmacy. The doctor might say, I am going to prescribe some antibiotics for your infection. Take them 3 times a day for 7 days.
Yes, Paul. A prescription is a special note from the doctor that allows you to buy certain medicines. You take the prescription to a pharmacy or drugstore to get the medicine. The pharmacist will give you the medicine and explain how to take it.
That is right, Emily. The doctor might also give you advice like, get plenty of rest, drink lots of fluids, stay home from work for a few days, or come back if your symptoms do not improve.
Yes, Paul. It is important to follow the doctor's advice. If you don't understand something, you should ask questions. For example, how often should I take this medicine? Or when will I start feeling better? Or what should I do if the symptoms get worse?
Excellent questions, Emily. Doctors expect patients to ask questions. It is your health, so you have the right to understand everything. Now, let us talk about calling in sick to work. When you are sick, you need to inform your boss or your workplace. How do we do this?
Well, Paul, the first thing you should do is call or email your boss as soon as possible. Do not wait until the last minute. You should call in the morning before your work starts. For example, you can say, hello, this is Emily. I am calling to let you know that I am not feeling well today and I will not be able to come to work.
Yes, Emily. That is clear and professional. Your boss might ask, what is wrong, or what are your symptoms? You don't need to give too many details, but you should give a general explanation. For example, I have a fever and a bad cold. I think it is better if I stay home and rest.
Good example, Paul. Your boss might ask, when do you think you will be back? You can say, I hope to be back tomorrow, or I think I need 2 or 3 days to recover. I will keep you updated.
Yes, Emily. It is important to keep your workplace informed. If you need to be off work for more than a few days, you might need a doctor's note or medical certificate. This is a document from the doctor that proves you were sick.
That is right, Paul. Some workplaces require a doctor's note if you are absent for more than 2 or 3 days. The doctor will write a note saying, this is to certify that Emily was under my care from Monday to Wednesday due to illness.
Exactly, Emily. Now, let us talk about some useful phrases for expressing sympathy when someone else is sick. If your friend or colleague is sick, what can you say to show you care?
Well, Paul, the most common thing to say is, I hope you feel better soon, or get well soon. These are kind and caring expressions. For example, if your colleague is sick, you can say, I am sorry to hear you are not feeling well. I hope you feel better soon.
Yes, Emily, those are very common and appropriate. We can also say, take care of yourself, or make sure you get plenty of rest. For example, take care of yourself and do not worry about work. We will handle everything here.
That is very kind, Paul. We can also ask, is there anything I can do to help? Or do you need anything? This shows that you are willing to help. For example, if your friend is sick, you can offer to bring them some food or medicine.
Yes, Emily. Offering help is very thoughtful. We can also say, let me know if you need anything. This leaves the offer open. The person can ask for help if they need it.
Exactly, Paul. Now, let us talk about some preventive measures. Prevention means things we do to avoid getting sick. What can we do to stay healthy and prevent illness?
Good question, Emily. The most important thing is to wash your hands regularly. We should wash our hands with soap and water for at least 20 seconds, especially before eating and after using the bathroom. This kills germs and prevents infection.
Yes, Paul, hand washing is so important. We should also avoid touching our face, especially our eyes, nose, and mouth. Germs enter our body through these areas, so if we touch our face with dirty hands, we can get sick.
That is right, Emily. Another important prevention method is to get enough sleep. When we sleep, our body repairs itself and strengthens our immune system. Adults should sleep 7 to 8 hours each night.
Yes, Paul, sleep is very important for health. We should also eat a balanced diet with lots of fruits and vegetables. These foods contain vitamins and nutrients that keep our immune system strong.
Absolutely, Emily. We should also exercise regularly. Exercise helps keep our bodies strong and healthy. Even light exercise like walking for 30 minutes a day can make a big difference.
Yes, Paul, and we should try to manage stress. Too much stress weakens our immune system and makes us more likely to get sick. We can manage stress through exercise, meditation, hobbies, or talking with friends.
Good point, Emily. Another prevention method is to get vaccinated. Vaccines protect us from serious illnesses like the flu, measles, and many other diseases. We should follow the recommended vaccination schedule.
Yes, Paul, vaccines are very important, especially for children and older people. We should also avoid close contact with people who are sick. If someone is coughing or sneezing, we should keep some distance.
That is right, Emily. And if we are sick, we should stay home to avoid spreading illness to others. We should also cover our mouth and nose when we cough or sneeze, preferably with a tissue or our elbow, not our hands.
Excellent advice, Paul. These preventive measures can help us stay healthy and reduce the spread of illness in our community. Now, let me share some useful expressions and phrases for talking about sickness.
Yes, please, Emily. This will be very helpful for everyone.
Okay. First, when we want to say that symptoms started, we can use these phrases. I started feeling sick yesterday, the symptoms began on Monday, it started with a sore throat, or I have been feeling sick since Tuesday.
Good examples, Emily. When we want to say that symptoms are getting better or worse, we can say, I am feeling better, I am getting worse, my condition is improving, the pain is getting stronger, or my symptoms are not improving.
Yes, Paul. When we want to talk about the severity of symptoms, we can say, I have a slight headache for mild pain, I have a bad cold for moderate illness, or I have a terrible stomachache for severe pain. We can use adjectives like slight, mild, bad, terrible, or severe.
Excellent, Emily. When we want to express that something hurts, we can say, my head hurts, my stomach is hurting, I have pain in my back, or it hurts when I swallow. These are all ways to express pain.
Good examples, Paul. When we want to say how often symptoms occur, we can say, I cough all the time, I sneeze occasionally, the pain comes and goes, or I feel dizzy sometimes. Words like always, often, sometimes, occasionally, and rarely are useful.
Yes, Emily. When we want to describe our general condition, we can say, I feel awful, I feel terrible, I do not feel well at all, I feel a bit better, or I am feeling much better now. These expressions describe our overall state.
Perfect, Paul. Now let us talk about questions that doctors commonly ask. The doctor might ask, how are you feeling? Or what seems to be the problem? Or what brings you here today? These are opening questions to start the conversation.
Yes, Emily. The doctor might also ask, where does it hurt? Or, can you point to where the pain is? Or, on a scale of 1 to 10, how bad is the pain? These questions help the doctor understand your pain.
Good examples, Paul. The doctor might ask, have you had this before? Or is this the first time? Or do you have a history of this condition? These questions are about your medical history.
Yes, Emily. The doctor might also ask, are you taking any medications? Or do you have any allergies? Or have you had any recent injuries or surgeries? These are important for safety and treatment.
Exactly, Paul. Now let us talk about some common medicines and remedies. We should know the names of common medicines in English. For pain and fever, we have paracetamol, which is also called acetaminophen in some countries, or ibuprofen.
Yes, Emily. For coughs, we have cough syrup or cough drops or lozenges. For a stuffy nose, we have decongestants or nasal spray. For allergies, we have antihistamines.
Good, Paul. For stomach problems, we have antacids for heartburn or acid reflux. For cuts and wounds, we use antiseptic cream or ointment and bandages or plasters. We also have throat lozenges or throat spray for sore throats.
Excellent, Emily. We should also mention home remedies. These are natural treatments that people use at home. For example, honey and lemon in warm water for a sore throat, ginger tea for nausea, or a cold compress for a headache.
Yes, Paul. Many people use home remedies before taking medicine. Some other home remedies include gargling with salt water for a sore throat, using a humidifier for a stuffy nose, or drinking chamomile tea to help you sleep.
Good examples, Emily. Now, let us talk about different health professionals. A doctor or physician is the general term for a medical professional. A general practitioner or GP is a doctor who treats common illnesses and general health problems.
Yes, Paul. A specialist is a doctor who focuses on one area of medicine. For example, a cardiologist treats heart problems, a dermatologist treats skin problems, an ophthalmologist treats eye problems, and a dentist treats tooth and gum problems.
Good examples, Emily. We also have a pharmacist who works at a pharmacy and gives you medicine and advice about medications. A nurse helps doctors and takes care of patients. A paramedic provides emergency medical care and works in ambulances.
Yes, Paul. Now let us talk about different places related to healthcare. A hospital is a large medical facility for serious illnesses and emergencies. A clinic is a smaller medical facility for routine care and minor problems.
Yes, Emily. A doctor's office or surgery is where you go for appointments with your doctor. A pharmacy or drugstore or chemist is where you buy medicine. The emergency room or ER or A&E is the part of a hospital for emergencies.
Perfect, Paul. Now I want to share some cultural differences in healthcare. Different countries have different healthcare systems. In some countries, healthcare is free or very cheap because the government pays for it. In other countries, you need private health insurance.
Yes, Emily. This is important to know when you travel or live in a different country. In some countries, you can see a doctor without an appointment by going to a walk-in clinic. In other countries, you always need to make an appointment in advance.
That is right, Paul. Also, in some countries, you can buy many medicines without a prescription at the pharmacy. In other countries, you need a prescription from a doctor for most medicines. These differences are important to understand.
Absolutely, Emily. When you travel, you should research the healthcare system in that country. You should know how to access medical care in an emergency. You should also consider getting travel health insurance to cover medical costs while abroad.
Excellent advice, Paul. Now let me summarize the main vocabulary we have learned today. We learned how to say we are sick using expressions like I am sick, I feel sick, I am not feeling well, I am under the weather, and I am coming down with something.
Yes, Emily. We learned about common illnesses like cold, flu, headache, stomachache, and toothache. We learned about symptoms like fever, cough, runny nose, stuffy nose, sneezing, sore throat, tiredness, nausea, vomiting, diarrhea, and dizziness.
Exactly, Paul. We learned how to describe pain using adjectives like sharp, dull, throbbing, burning, and stabbing. We learned about treatments like rest, medicine, fluids, and healthy food. We learned about going to the doctor and describing symptoms.
Yes, Emily. We learned how to call in sick to work professionally. We learned expressions for showing sympathy, like I hope you feel better soon and get well soon. We learned about prevention methods like washing hands, getting enough sleep, eating well, and exercising.
Perfect summary, Paul. We also learned about medicines, health professionals, healthcare facilities, and cultural differences in healthcare systems. This is a lot of useful vocabulary for talking about health and sickness in English.
Absolutely, Emily. This vocabulary is essential for daily life, especially if you live, work, or travel in English-speaking countries. Being able to communicate about your health can be very important, sometimes even life-saving.
Yes, Paul. I encourage everyone to practice this vocabulary. Try describing symptoms you have experienced. Practice calling the doctor's office for an appointment. Practice explaining to your boss that you are sick. The more you practice, the more confident you will become.
Great advice, Emily. And remember, it is okay to ask people to repeat or to speak more slowly if you do not understand, especially in medical situations. You can say, "I am sorry, I did not understand. Can you explain that again, please?" Or, "Could you speak a little slower, please?"
Absolutely, Paul. Your health is important, and clear communication is essential. Do not be embarrassed to ask for clarification. Medical professionals understand that English might not be your first language.
Yes, Emily. Well, I think we have covered this topic very thoroughly. We have shared so much useful vocabulary and many practical examples. I hope everyone feels more confident about talking about health and sickness in English now.
I hope so too, Paul. This has been a very informative conversation. Thank you so much for discussing this important topic with me today.
Thank you too, Emily. It was a very useful discussion. I learned some new expressions myself.
That is wonderful, Paul. Okay, everyone, before we finish today, I want to ask you a question. We would love to hear from you, so please leave a comment and tell us, what do you do when you have a cold? What home remedies do you use? We are very curious to know about different remedies from different cultures.
Yes, please share with us in the comments. Different cultures have different home remedies and traditions for treating common illnesses. It is fascinating to learn from each other, so please tell us what you do when you feel sick.
That is right, Paul. We love reading your comments and learning from you. Your comments also help other learners practice reading and writing English. So please take a moment to write a comment. It can be short and simple.
And remember, everyone, please like and subscribe to English Club for more English learning videos. We make new videos every week to help you improve your English. Your support means everything to us.
Yes, please like and subscribe. It really helps our channel grow and allows us to continue creating helpful content for you. Thank you so much for listening today. We appreciate you taking the time to learn with us.
Thank you for spending time with us today. We hope you found this lesson useful and practical. Remember to take care of your health, wash your hands, get enough sleep, and stay healthy.
Yes, take care of yourselves, everyone. And if you do get sick, now you know how to talk about it in English. Keep practicing your English every day. You are doing wonderfully.
Goodbye, everyone. Stay healthy, keep learning, and see you in the next video.
Goodbye. And remember, please like and subscribe to English Club for more English learning videos. Thank you for listening.